Digital Government System for COVID-19 Quarantine and Tracing. Self-Quarantine Management in Korea. Hello, my name is Shin Il-chul, Senior Deputy Director of the Self-Quarantined Management Team in the Ministry of the Interior and Safety. The purpose of this course is to help you understand how Korea managed persons under self-quarantine due to COVID-19. The management of self-quarantined persons is the fundamental of COVID-19 responses, including prompt epidemiological investigations to separate people having contacts with infectious individuals, to conduct diagnostic tests and medical treatments to patients. Each country faces different circumstances. But I hope that lessons learned from the management of self-quarantined persons in Korea based on ICT can be used as a benchmark for you to develop countermeasures on COVID-19 in your country. To be specific, I will continue my lecture in the following order: understanding the basic concept of self-quarantine, key features of self-quarantine management in Korea, organizational structure of the enforcement system and roles of designated case officer, key activities to manage inbound travelers, management of unauthorized leave, ICT-based approaches to manage persons under self-quarantine, including safety protection app, and K-quarantine characteristics as a wrap-up. The course objectives are to learn the basic concept of self-quarantine, figure out key features of self-quarantine management using self-quarantine safety protection app in Korea, and understand main quarantine management activities for inbound travelers, the unauthorized leave, etc. First, let me explain the general concept, categories, and status of self-quarantine in Korea. Self-quarantine is to place persons suspected of being infected by the virus under isolation at home for some time period in accordance with the Infectious Disease Control and Prevention Act and the Quarantine Act. Self-quarantined persons are largely classified with ones who have been in contact with infected patients and those entering Korea from abroad. An inbound traveler, or one who is identified to have contacts with infected patients through epidemiological investigations, should isolate themselves for quarantine. A self-quarantine notice is sent to such person, and a case officer is designated to monitor his or her status for 2 weeks, and which is the main task of self-quarantine management. As for Korea, the number of self-quarantined people declined after peaking at 59,918 people on April 14th. However, the number of persons is under self-quarantine as of August 23rd is 58,487. It means an increase due to the respread of COVID-19. Let's move on to the progress regarding the self-quarantine management in Korea. The first confirmed cases occurred in Korea on January 20th of this year, and the self-quarantine coordination activities were transferred to MOIS from Korea Centers for Disease Control and Prevention, KCDC, and MOIS became in charge of the task on February 9th. Therefore, MOIS established and began to operate the self-quarantined person management team. As the number of confirmed cases increased rapidly, along with the 31st case on February 18th, the government raised the crisis alert level to the highest, level 4, and began to operate Central Disaster and Safety Countermeasures Headquarters, CDSC. To manage a large number of persons under self-quarantine efficiently, we developed and introduced Self-Quarantine Safety Protection app from March 7th. The government issued the self-quarantine order to all incoming travelers by the end of March, and it led to the surge of self-quarantined persons. Enforcement system refinement was one of our main tasks. The self-quarantine management system was reorganized and quarantine control activities were transferred to MOIS and local governments from KCDC on February 9th to help the health authorities focus on disinfection activities. To be specific, MOIS established self-quarantined persons management team under its supervision, and local governments operated teams dedicated to self-quarantine management centering on disaster response divisions, and the central government monitored the general operating status. In addition, we have established a solid disease prevention network available to allocate 10 officers per a self-quarantined person upon emergency based on the cooperation among police, firefighting authorities, and other related agencies. Let's talk about designated case officers. Basically, we apply the one-to-one management approach. There are 39,885 designated case officers, and this one-to-one management system can be said as the essence of the 10-to-1 disease prevention network. Each case officer is responsible for the management of approximately 1.4 persons under self-quarantine. We allocated 3 times more officers in advance for a potential surge in self-quarantine cases. The designated case officer monitors abnormal symptoms and unauthorized leave of those under self-quarantine for 14 days. As seen on the picture on the right, we provide them with basic supplies and hygiene kit and support for personal needs. All case officers are committed to conduct their duty, who are often strict or warm sometimes. Now, I will explain you on the Self-Quarantine Safety Protection app, which is well known to other countries already. The Self-Quarantine Safety Protection app was developed to support the efficient monitoring of self-quarantined persons, as a case officer often had to take care of 14 persons to the maximum in some regions due to the surge of people under self-quarantine since the mass infection from Shincheonji religious group. The main functions of this app is to find the location of those under self-quarantine, to detect whether or not they leave the quarantine area, and support them to check fever, cough, and other symptoms, and send the results to the case officer. When an alert is sent to the case officer makes a phone call or visits the self-quarantined person after receiving the alert. This app was developed in 2 types, for the self-quarantined and the case officers. It also supports 8 languages to manage inbound travelers entering Korea from many countries. Let's move on to find out key features of Self-Quarantine Safety Protection app for the self-quarantined. One of its main functions is self-diagnose support. With this app, persons under self-quarantine can conduct a self-diagnose on 4 items, including fever, cough, sore throat, and difficulty in breathing, dyspnea, and submit the result. If there is any abnormal symptom, it sends a notice to the designated case officer. Second, location check is that a person under self-isolation is required to save his or her address to the app. A push notification is sent to the case officer if the person leaves the location without permission. In addition, it sends a pop-up message to alert the time for the self-diagnose in advance. And the app provides guidelines for families and those living in the self-quarantined persons, as well as contact information of the designated case officer. You are now seeing screenshots of Self-Quarantine Protection app for case officers. The first is the Self-Quarantined Person Management status screen of the app for case officers. Case officers can find the list of persons under their monitoring. Also, the officer can check whether or not such persons submit the self-diagnose result or have any symptoms. A push notification is sent to the officer when the self-quarantined person leaves the designated location, helping him or her detect unauthorized leave easily. Let's move on to the inbound traveler management. The Korean government began to issue the self-quarantine order to inbound travelers since the end of March amid worsening situations around the world. Self-quarantine orders have been issued to inbound travelers from Europe March 22nd, from the US April 1st, and the scope of order expanded to include all inbound travelers, such as Korean residents and long-term foreign visitors, since April 1st. On average, the number of persons who entered Korea from foreign countries and were required to isolate themselves for quarantine was 3,159 per day since April 1st. Through the special entry procedures, all inbound travelers are allowed to enter Korea only when they install the Self-Quarantine Safety Protection app to check their current location. And we installed banners in the airport to provide instructions, as you see in the picture on the right. When inbound travelers submit their address and other personal data through the app, case officers are designated immediately for monitoring. In the meantime, Korea is utilizing its advanced information technologies for self-quarantine management proactively. First, GIS management system marks the location of self-quarantined person on the map in real time by linking with the Self-Quarantine Safety Protection app mentioned before. With the system, we can check the history of unauthorized leave and trace their movement. Next, QR code-based registry for public places is developed to obtain the contact information of those having contacts with infectious individuals upon mass infection so that they can undergo diagnostic tests promptly. The visitors are required to scan the encrypted one-time QR code through their smartphones, and the collected personal data is used, if necessary, mass infection. Currently, 99% of bars, entertainment facilities, and other public places that are required to install QR code-based registry are applying the system. Lastly, WPS stands for Wi-Fi Positioning System, and the system was introduced to increase the accuracy of detecting the location due to the poor performance of GIP-based app in indoor positioning. Thanks to the system, the app accuracy has improved by more than 3 times. Moving on to the operation of quarantine facilities. We operated temporary residential facilities for Koreans returning from Wuhan, China, and other foreign regions to isolate them for 14 days. A total number of 1,814 Koreans from 5 countries was admitted to such facilities. Also, we are operating other temporary residential facilities for foreigners on a short-term visit with no residence in Korea. As of August 23rd, 1,341 foreigners are admitted to the facilities. The fact that we are providing temporary residential facilities for foreigners on a short-term visit indicates that the country maintains the open-door policy in response to COVID-19. The picture on the right shows thank you notes from foreign visitors to government officers for helping them stay safe and healthy in the temporary residential facilities. Local governments, too, operate temporary facilities by themselves, and as of August 23rd, 1,192 persons are staying at 59 facilities. Next topic is about the management of unauthorized leave. Those who left the designated location without permission are managed by using the Safety Protection app, strengthened regulations, an obligation to wear a wristband. I explained earlier on the Safety Protection app. We have upgraded the app recently to adopt the motion detection feature, which sends an alert to the case officer when no movement of mobile phone is detected for 2 hours to prevent people going outside while leaving their smartphones at home. Also, we are asking those who left their designated location without permission to wear the wristband. It is connected with a smartphone via Bluetooth, and it sends an alert when it becomes distant from the phone or is damaged. In May, we signed a contract with Saudi Arabia to export 100,000 units of wristbands. In the past, when those who were under quarantine left their location, we warned them first. But now, we shifted our stance to the zero-tolerance policy, or the one-strike principle for violators, to report them to the police without warning. Also, we have strengthened penalties in the Infectious Disease Control and Prevention Act since April. With regard to responses to unauthorized leave, domestic residents who violated the obligations were sentenced to imprisonment for 4 months. As for foreigners, some of them were arrested or a deportation order was issued to 44 persons. Likewise, the judicial authority is applying more strict rules to unauthorized leave. Now, I will explain you some novel ideas of local governments developed during the self-quarantine management. There are safe accommodations for family members of foreign entrants, helping them stay there at a reasonable price, while the self-quarantined person is at home for self-quarantine. Such safe accommodations are operated through contacts between local governments and accommodation providers, and 159 accommodations are in operation in 13 cities or provinces as of August. Local government also provides rented camper vans to be used as separate space for quarantine in order to relieve concerns over infection of family members of the self-quarantined. To prevent COVID-19 and boost the mental health of those under self-quarantine for 14 days, some local governments are providing planting kits, and this campaign has spread to the central government. Considering that the self-quarantined persons cannot install the Safety Protection app without smartphones, 11 cities and provinces are providing smartphone rental services to them. Let me wrap up the course with K-quarantine. The main characteristics of self-quarantine, called as K-quarantine, can be summarized as follows. The main characteristics of K-quarantine can be summarized as follows. The self-quarantine management of Korea is based on democracy, openness, and transparency, and supported by the public engagement, cooperation between the central and local governments, information technologies, and which laid the foundation to fight against COVID-19. Unlike other countries that decided to issue the self-quarantine order to all citizens and lock down the entire city to stop the spread of the disease, Korea continued to maintain the open policy, both at home and overseas, and limited quarantine on inbound travelers and those in contact with the infected. The voluntary civil participation, including those under self-quarantine, was a great help. Also, the ministries centering on the Disease Prevention Authority and the Prime Minister and local governments discussed ways to tackle the disease each morning and cooperated together to show a democratic stance. In the meantime, we used the Self-Quarantine Safety Protection app and various systems to share the information, which constitutes a main aspect of K-quarantine, that is, transparent and efficient management of self-quarantine based on information technologies. In closing, I would like to explain the meaning of above figures representing K-quarantine. The first one indicates the total number of people who were under self-quarantine until August 23rd. Domestic residents having contacts with infectious individuals are not obliged to install the Safety Protection app. However, they volunteered to install the app, and now the installation rate stands at 91%, and the unauthorized leave rate is mere 0.16%. I believe that such remarkable success came from the dedication of 77,385 designated case officers working for local governments who were often strict but sometimes gentle to guide the self-quarantined persons. We will work harder with the 77,385 case officers so that the self-quarantine management and disease prevention control measures of Korea can contribute to ending the global COVID-19 pandemic in the near future. Thanks for listening.